So, I want to talk about this. I want to go to the controversial stuff. You did a retreat.
My toe in. Yes,
You did dip your toe in, and I'll
yes.
lead the way. I'll if anybody needs to be crucified, it'll be me. But so, tell me what happened when you were at this retreat talking about these issues.
Sure. Yeah, we're talking about. I was presenting on a lot of different topics about men's health, right? There was a retreat at this place, 1440 Multiversity, which is beautiful. Highly recommend checking it out to see what kind of workshops they have up in Santa Cruz. And I was talking about all different things about men's health. And maybe for a small part of it, I brought up this idea that we talked a little bit about earlier about how I'm hearing from guys that it's just kind of a hard time to figure out what does it mean to be a man in 2019, 2020, this time of life. Like, it's just hard to know what you were raised with in terms of what being a man means and what is applicable of that stuff now and appropriate now and what's just being a jerk, even though you were told. Anyway, so I just talked a little bit about that, and I brought up this story, which is kind of a really interesting story. There's this woman, Brene Brown, who's
I know.
you know Brene Brown, right?
Not personally, but
yeah, she's gotten
She's
huge.
great.
Yeah, she did a TED Talk. She writes all about mostly women and vulnerability and shame. That's her big thing, right? And she's become huge because she did this amazing TED Talk on it. So she tells the story about how she was at a book signing, and she writes all about how the antidote to shame is being vulnerable and sharing what you're shameful about.
Yeah.
And that then dissipates that sense of shame. And so she writes about that. So she talks about how she's at a book signing, and there's a woman there with her husband and her daughter, like an older daughter, like a college-age daughter. And after the book signing, they go up and have her sign their books, and they're walking away, and the husband/father is sticking around, and they're like, "Come on, honey, we're done. We got Dr. Brown to sign our book."
Yeah.
And he says, "No, I want to ask Dr. Brown a question." They're like, "Well, no, she does women's stuff. You know, you just came to be with us." And he's like, "No, I have a question." So he goes up to Dr. Brown, and he says, "How come you only studied women's, issues and vulnerability and shame, and how come you only write about women's issues and vulnerability?" She's like, "Well, that's, what I focus on, and that's all I really, have really felt I wanted to expound upon and all that." And he goes, "Well, isn't that convenient?"
He was angry.
Yeah, and she was like, "Whoa," because usually it's all very people adoring her and wanting her to sign their books. And she's like, "Well, what do you mean?" He says, "Well, because your hypothesis totally doesn't work for men. That's why you don't write about men, because what you're saying doesn't fit."
Yeah.
She's like, "What are you talking about?" He's like, "You talk about how the antidote to shame is about sharing your vulnerability. So my wife and daughter here are telling me, 'Dad, you need to open up and tell us what you're feeling about things. We can see when you're stressed or you're upset. You need to share more.'" He said, "The only way I can describe the look on their face when I actually do open up and share something I'm ashamed about is a look of disgust."
Wow.
He said, "They'd rather see me die on my white horse than fall off of it."
No kidding.
Yeah. And that really speaks to this, how do we behave as men and still be found attractive and be powerful in the way that masculinity connotes we're supposed to be and is expected of us, and yet also be respectful and not dismissive and abusive and all that. So it was interesting because I just told that little story in this talk, and I gave, like I said, it was a few different talks over that weekend. That one little story is what all the questions after my talks were about. I talked about prostate cancer, cardiovascular disease, testosterone, no question about any of that. It was all about, tell us more about that. How do we deal with that from the women and the men? How do we navigate this now? I feel like, and I'm not a psychologist, so I'm not an expert in this, but I feel like that's kind of this burning need. And that ends up manifesting in what I see in health problems.
It so does. Yeah.
Yeah, so it's a
I see this stuff in the ER in the same way. It's just this.
sure.
There are parts of masculinity. This is what it means to be a man. You can see it in the older generation, like this World War II guys, that we never complain. So they have chest pain, they have a heart attack, they don't complain, they don't come in, and they suffer, and some of them die because they don't say anything. Just one obvious example. But that's great. That surprises me that you talk about all of these medical things in this conference, and that's what men want to know about.
Yeah, I think that's what they're confused about.
Yeah, this is the topic of masculinity and what does it mean to be a man in the Me Too era?
Right. Right.
One of the things that we were talking about, you and I were talking about, that's come up is, I think everybody says no, sexual assault and all this stuff, that's obviously wrong. right? But the gray area is, and I experience this too, I think most women still want a man to make the first move and to be a gentleman and to pay and to be, boy, aggressive sounds wrong, but assertive, or at least to demonstrate courage in asking a woman out and initiating things sexually. And that's like this gray area of, am I doing something wrong now? Like, was this okay 30 years ago socially? Now it's not okay, but they still want it, but you know what I mean?
Yeah, no, it is. It's difficult. I don't even want to go there.
You don't have to. You can avoid it.
That's what I see, though. I see the guys who are stressed out about it all, and it's affecting them health-wise in terms of testosterone and sleep and
it affects
all
the rest
sorts of
of
things.
them and
exactly.
why they're coming to you.
Yeah.
Who is
tricky.
Who is the Brene Brown for men?
I don't know. I dance around the edges of that. I would love to know who that person is. I don't feel like going and getting a PhD at this point in psychology, but yeah,
maybe you'll have another moment that will
push
you in
exactly.
that direction.
There you go. No, I'm not doing that. But yeah, I think it is needed. I think it's a whole discussion. It's not one person, but I think obviously it's a whole. The opening needs to even be there. I don't know if we're quite even ready for that conversation in a way.
Maybe it's
there's still a lot of sensitivity, and I think hopefully we're getting ready to have a little more openness about how to behave.
Yeah, I think things swing. There's always pendulums, and
Right.
I think in general we're progressing.
Yeah, I hope so.